met last time, Honor and I were to go back and look at drafting some language that we could utilize for a loan repayment program for nurse educators. So we've drafted that, and it would be modeled after the APRN loan payment, that if they worked in a public institution for 2 years, they could apply for a $15,000 loan forgiveness. And they could apply for that a couple times so that they would be at the program at least 4 years, and hopefully embedded in the community by then. But I didn't bring copies. I didn't.
Okay.
Sorry.
No, not a problem. Would you bring copies of that next time for us to review? Anybody have any questions related to that for Peggy? Thank you for doing that, and look forward to working with you to see where we need to do to take that and move it forward. Also, we have another new face here today, Jillian Purser, Paula Green, also from LSA. And these ladies have just done a phenomenal job. Jillian actually has been on her honeymoon, so congratulations on your new life adventure. She actually just got back today, so thank you for being here with us. She has put us together a packet of information from NCSL, which is the National Conference of State Legislatures. And I had asked LSA to pull some legislation related to healthcare workforce, pieces of legislation that potentially had been done throughout the nation for us to take a look at. And as we look through this, if you see something that is in your area of expertise or interest that you feel that you would like more information on, or you would like for us to pull these specific bills, let me know which one that you have an interest in us reviewing, and then next meeting we will go back and look at some of these pieces of legislation, maybe ask the ladies in LSA to help us get those bills and to see what sort of outcomes they have had related to it. So specifically, as you look through that list, just kind of flag some ones that you may have interest in looking at. Do you have any comments related to this that you would like to share?
If you'd like me to summarize the highlights, I can.
That would be great.
Where do you want me to stand?
Wherever is most comfortable. You just want to come up here and use this microphone?
I want to make sure the Zoom.
Yeah.
Okay, can you hear me? Great. So this is from NCSL, and it just highlights what other states have done to on this workforce, specifically the healthcare workforce issue. The first thing, which you guys have already done, is to establish a task force. So gold star on that one. I will say, just to kind of summarize, 14 states have some type of student loan forgiveness or scholarship program. Some of them are based specifically on the location of where the person ends up serving. Some of it's about the specific program. There's a lot of different details in there, but like Senator Weaver said, I'd be happy to pull any of that information. Some of the task force mentioned have also already put out their reports. So if you're interested in what other states are doing, I know Colorado specifically released a report, I believe it was last year, but didn't have a chance this morning to look that over, but I would be happy to if you're interested. Speaking specifically, I know you mentioned high schools earlier. West Virginia in the last few years has enacted a nursing career pathway program, specifically starting in high school, and it deals a lot with dual enrollment programs and partnerships with local clinics to get those students in there for internships. So that's something you might want to flag. And then Louisiana specifically also has a scholarship program aimed at those 2-year programs, so assistant programs that you might want to consider. And then there at the very end, several states are directing medical schools regarding residency, so that might be specifically directing residency programs to create these certain kind of programs to fill gaps that the state legislators are noticing. But that's just kind of a summary of what's in here. We'd be more than happy to look into anything or give you any more information if you guys have any questions.
Thank you so much. So to keep this in a workable form, after you review this, if you have bills that you specifically would like for us to review possibly, send your list to Caitlin. And Caitlin, if you will keep a running summary of things that people are interested in, if we have a lot of interest in a lot of things, we'll just look at it and, if there are 2 or 3 things that a lot of people have asked specifically to have information about, we will get that summary back to you, Jillian, and then work on bringing more information for the next task force meeting, if that's okay. Thank you so much for doing this. Very, very helpful. Does anyone have any questions for Jillian? Nope. Welcome back again. Thanks so much for doing that. Moving on to our presentation on dentistry by Dr. Studstill and Dr. Lockwood. Welcome to the task force, Dr. Lockwood. So which one of you will be presenting about dentistry today?
Well, Madam Chairman, if it's okay with you, I'll introduce Dr. Lockwood, and he will do the presentation.
That would be perfect.
And then I'll have a couple of suggestions maybe at the end.
Okay, the floor is all yours.
Dr. Lockwood, if you'd come up here and get around one of those mics so where everybody can hear you. Press a little button there, so. Thank you. Stuart Lockwood graduated from the University of Alabama School of Dentistry a few years after I did, and he set up practice in Union Springs, Alabama. So he practiced in Union Springs for several years. So he understands small town rural dentistry firsthand. And then after that, he decided that he wanted to go into public health, got a master's degree in epidemiology, oral epidemiology at the University of Michigan. And then with that degree, he came back to Alabama as chief dental officer of the state Department of Public Health. And he now is working at UAB, helping them out with some HRSA grants and things and doing that. But the very best thing that I can say about Dr. Lockwood, he's my personal friend, somebody that really helps me and gives me all the information I need because data drives policy. Dr. Lockwood.
Yes, thank you. Can everybody hear? Is this good? I'm thrilled to be here this morning and to see Senator Weaver again. We've met in the last year, and this is my passion in retirement, trying to get dentists to rural, small town Alabama because there is a crisis getting dentists to rural, small town Alabama. And at the end, I'll talk a little bit about my experience in Union Springs and that practice. But I am the data person. Sometimes I think I'm the dental data nut. I present data to different groups and provide data for different purposes. And so this is just a thumbs-eye sketch of what we've done over the last couple of years and where we find ourselves today. Next slide. This is presently the situation that I want to show you in several counties in the state that are at risk, if not already, have lost dental services. You take Greene and Clay County, they have no dentist. Coosa County has one dentist who provides services there 2 days a week. Lowndes County and Hayneville has one rotating federally qualified health center dentist from here 4 days a week. Perry and Fayette County have only one dentist, each 50 to 55 years of age. Next slide, please. Additionally, we have 4 counties that have 100% of their dentists age 60 or older. Wilcox, 1 of 1. Washington, 1 of 1. Lawrence, 2 of 2. My Bullock, 2 of 2. 4 counties between 60 and 83%, 60 years of age and older. Macon, Monroe, Butler, and Franklin. And then we have 5 counties that have half of their dentists 60 or older. Conecuh, Randolph, Marengo, Henry, and Sumter counties. Next slide, please. So in sum, today, We have 19 counties either with a loss or at risk of significant loss of dental services in the near future. Next slide, please. Sure.
While she's working on that, are y'all okay with us sharing this with our task force?
Yes.
Will you send that out this afternoon? So if you don't feel like you have to take notes on all that, we will send this slide out, or his presentation to you this afternoon.
I did want to thank you for making that slide there. We're so proud of our dentist in Coosa County, we can't stand it. And that's all we got.
Right. We good now? All right, let's go to the next one then. You know, this issue came up several years ago when I was the state dental officer at ADPH, and we'll go into a couple of things, but one of the factors that didn't start this, but that is the state of the fact that Alabama ranks 51st of all states in the DC in terms of dentist to population ratio. Nationally, there's 61 dentists per 100,000 population. Statewide in Alabama, we have about 41. We're about, 33%, a third the number of dentists per 10,000 population. A lot of my data, I cut that down to 10,000 to do county estimates, but this is one factor that we look at here to show you where we stand. Next slide. And on January 1, 2017, we learned that 33% of 2,127 dentists in the state were 60 years of age and older. A third of all dentists in Alabama were 60 or older. And why are dentists so old? We don't go over that. But why does this play such an important factor in the shortage of dentists in our state? Next slide. This is a little complicated, but this is a graph of the UAB School of Dentistry graduates. There's only one dental school in the state. Their first graduating class was in 1952, and this goes through 2018. That bar represents 57 graduates, except for a 10-year period of time, starting in 1975, going up to 1985. And what happened in 1970, the federal government gave the dean of the dental school federal money if they would increase the size of their class 10% each year, they would continue to get federal money. So they went from 57 up to about 83 or 84 over a 10-year period. They withdrew the federal money and they dropped back to 57. The dean used that money to renovate the school that was, built in the 40s. And so as a result, there's 169, 170 excess dentists during this time period. And starting in 2015 and beyond, even to today, those excess dentists are retiring. Next slide. So, what are the factors in 2017 that caused us to think there is a pending crisis in rural small town Alabama? As I said, Alabama had the worst dentist to population ratio in the country, and Alabama had an older dentist population. Look at this here. In our smallest 25 counties, over half of all the dentists were 60 plus years of age. And in our most rural 41 counties, 42% were 60 plus. Okay? This was in 2017. Go to the next one, please. Further, many of our dental graduates were leaving the state or staying in Jefferson County. In 2017, we had as many dentists in Jefferson County, 545, as in our 54 non-urban counties. There was only 455. The graduates either stay in Jefferson County or they leave the state. And one factor that we looked at, and I had a complicated slide, but I won't show you, but we looked over a 20-year period of time, graduates from 1994 to 2014, and we looked where they were in 2017. 43% of those were not in Alabama. They had left the state. On average, out of that class of 57, 25 of them left the state. And so they're either leaving the state or they're staying in Jefferson County. Another factor is the role of gender in dental classes, and we asked the question, would females who in 2017 made up half of the dental class, in the class of 1977, there were 3 females. And so it's up to 50% now. And we wondered, would they go to rural small town Alabama? There was evidence in 2017 that they wouldn't. 80% of our female dentists in 2017 were in our largest 9 counties. That's 400 out of 499.
Let me see.
Let me remind you, if you're on our Zoom call, you may want to mute your microphone, please.
Form BG fuel injection flush.
Next slide, please. Okay, then we want to look what has happened from 2017 to 2022. This is new data that we've gotten from our database of practicing dentists. Alabama still has the worst dentist to population ratio in the country. Why? The older dentists are and have retired. In 2022, there were 150 fewer male dentists age 60 plus than in 2017. Next slide. Many Alabama counties had a net loss of dentists from 2017 to 2022. Overall, there was a net loss of 34 dentists in the state, but 29 counties had fewer dentists in 2022 than in 2017. 20 counties had a net gain of dentists, 18 counties had no change, but in our smallest 25 counties, 10 of those counties lost dentists in that 5-year period. 2 gained and 13 had no change. Next slide. So this is a summary of what we've gone over. But then the point, going back to kind of what I started with at the end here, in 2022, we've got 13 counties that have 50 to 100% of their dentists 60 years of age and older. Next slide. And we wanted to look at the effect of gender in these graduating classes, and that became 50% women. From 2017 to 2022, there was a net gain of 116 female dentists in the state. They went from 499 to 612. That's about 28% of all dentists in the state now. A net loss of the 150 male dentists who retired. But very interestingly, female dentists are to some degree going to our smallest 41 counties, as we had a net gain of 21 female dentists in our smallest 41 and had a net loss of 9 male dentists in these counties. So there's, nobody has an explanation for that. We just don't know, but that's a little good news. Next slide. And whether male or female, this is one of the issues that every graduate faces. Tuition at the UAB School of Dentistry is less expensive than many U.S. dental schools. The average debt of a graduating dental student at UAB is over $200,000. Nationally, it's almost $320,000. The cost to start a dental practice range from $400,000 to $500,000. And, unlike me, when I graduated, I had no student debt. But a lot of people in my class had no student debt. And that limits what your practice options are, whether you go into a solo practice or in with somebody else or whatever. But this kind of debt greatly impacts the choices for practice types and locations, and the out-of-state opportunities are winning. Next slide.
Dr. Lockwood, excuse me just a minute. For our friends on Zoom, I understand that it's going to log out in about 10 minutes. So when it logs out, you just have to log right back in to join the presentation again. I'm sorry about that.
No
Go right ahead.
No problem. So again, where are we today? We have these 19 counties either currently with a loss of dental services or in the near future. And, I just wanted to tell you what this means to me. It's a personal story, but I looked it up on November the 5th. It will have been 39 years ago, on November 5th in 1983, that I was practicing in Union Springs. I started out there in a rural clinic. There's many rural clinics in Alabama now. Started out in a rural clinic and brought a partner in, and we had to share a relatively small office. And so I worked, those of you from small town remember half a day a week, small town closed to be open on Saturday. And so we split, and I ended up working on Saturday. I wasn't married at the time. And there was a big need on Saturdays. And I was to go with my girlfriend then to the Auburn football game for homecoming. And Boomer Esiason was playing for the University of Maryland. And he set all kinds of records that day, I read about later. But when I got there that morning, they were lined up at the office door to get in. And I said, my goodness. And so we got going, and they kept coming and they kept coming. And my girlfriend lived in here, my wife now. She was at her parents' house out in the country. And I said, I'm not going to get there. I'm not going to get there. This is just unbelievable. And I left about 1:30, and I had pulled teeth for 23 people that day. 23 people at $10 a pop. It's $100 or more now. And to me, this is about what's going to happen to those people. Bullitt County, my partner, turned 70 years old in December. The other dentist in Union Springs is currently 66. And we have 13 other counties, near that. And, from that's where my passion for this comes from. And well, I hope there's some solutions and suggestions to carry forward.
Well, good morning. My name is Ken Kirkland. Thank you, and I appreciate the attention to detail that you provided. I just have a couple of quick questions. The code of regulations for dental schools. So they regulate everything from dentistry all the way down to dental assistant. Most recently, with one of our dental hygiene programs, we're at about 25 students for that dental hygiene program, and the 2022 standards rolled out and required that college encumber an additional 2 more full-time employees for the same set of students. And I just wonder if that is impacting the School of Dentistry's ability to accept more students? Are those regulations now becoming a barrier to the school's ability to bring in more dentists? To be able to, sometimes that answer is we want more, but I think those are the Commission on Dental Accreditation is who accredits a dental program. And so they set the ratios for what can be in the labs, what can be in the students, and sometimes that impacts how many students can we take. And I know that's affecting us on our side, and I just wonder, is it affecting you on your side?
Well, I'm an adjunct faculty at the dental school, and I lecture on public health, dentistry, and epidemiology. But only thing I know there, the dental school received their new 7-year accreditation within the last year, and how that affects their faculty and whatever, I don't know.
And if anything, I'm only saying it to hopefully support your case, because I think the accreditation serves as that gold standard seal that you're looking for, so that you know that any school of dentistry that I come from, or school of dental hygiene or dental assisting, you've met a standard to meet that healthcare. And it's the same in any of our other healthcare disciplines. But at some point, you start to question if those ratios are really appropriate enough that they're starting to become barriers to you being able to accept more students. And then if you accept more students, what does that look like? And is there enough qualified, well, we call them preceptors on our side, but is there enough for that field internship phase of that, or field residency side of that? Is there enough dentists to be able, if you were to increase the number, to be able to line them up for that one-to-one residency? And again, just hopefully supporting your case.
If I can add on to that, the dean has just increased the school size from about 80 up to about 104. So they're scrambling to find not only preclinical space, but clinical space is going to be critical, because you have to have a certain number of clinical instructors on the floor at all times when students are seeing patients. And so they've got to renovate. They're renovating. I think they've already completed the renovation, or they're trying to find places in the school as it's constructed right now to really take care of those students. So you're exactly right. It is a problem, and it's going to be a continuing problem. The good news is we were just accredited by CODA last year, so it won't be for another 4 years or 7 years, whatever that deal is. Thank you.
I don't know, so I'll ask the experts. If you're in medical schools, I understand it 2 years of school, and then you have clinicals for 2 years, and then 3 years residency. How is it for a dentist? Do you guys have clinicals or residencies before you get your certified to practice on your own?
There are residencies for specialists, for oral surgeons, periodontists, endodontists. Pediatric dentistry has typically 2-year or 3-year residencies. There is a general practice residency that's typically 1 year in length. That is a hospital-based residency that, what percent, maybe there's a third of all graduates that do some type of residency. That's usually the very specialized. I would say 10% or less do the 1 year general practice residency, and certainly 50% to 60% go into a practice after graduation.
So residency is not required to be a DMD.
No.
Okay, thank you.
So if I can follow up,
I had one comment. My name is Chris Schmidt. I own and operate nursing homes and rehab centers here in Alabama. And it was a serious problem. I've been doing this for 35 years, but it was a serious problem maybe up to about 15 years ago. You know, our issue was getting the patient to the dental office, and that was difficult as it was. But then mobile dentistry has started to develop, at least to service the skilled nursing population. And it's really helped our population out because as we age, we all know how important our teeth are as far as nutrition and eating and things like that. But it's really made a difference. And it appears that there's multiple and competing dentistry companies because they compete for my business, for my patients and things like that. So I'm just wondering if something like that might be not the perfect solution for a community with no dentists, but there definitely are companies moving the dentists, in and out of our facilities, and maybe it could be where they would do something in one of these counties that didn't have people. But I had no idea that this was such a problem, so I appreciate you guys bringing it up. I mean, really no idea. So good.
So I have a question to piggyback on that. If you have mobile dentistry going to a county, where in your data are those? If they're based in Jefferson, are they showing in your Jefferson numbers?
To my knowledge, there are no full-time mobile units. I'm familiar with some of his are based out of Louisiana that have served nursing homes. But, back in the 60s, the Department of Public Health had mobile units that went throughout the state. Jefferson County had a series of mobile units that dental students and whatnot served on throughout Jefferson County, but that's the only ones I'm familiar with. Zach,
what I can add to that is that the one reason they're not mobile clinics like there used to be at one time is that Board of Dental Examiners have rules that say that not only they're really strict on how the mobile clinics have to be operated, number one, and that's been really made more restrictive because some mobile clinics didn't have the right equipment, right things to treat patients. That was a problem. And then the second thing is that if you're going to have a mobile clinic and you set up the mobile clinic, say in Greene County, and you're there for a week or whatever, somebody has to be in Greene County to see patients as a follow-up for problems. And that's a problem because that mobile clinic is moved off. So the Board of Dental Examiners rules are really restrictive because of making sure that patients have care who have emergencies as a result of that dental care.
So I'm just curious, when you have mobile dentistry come to your skilled nursing facility, do you have a certain clinic room set up in your facility, or do they do it in another? How do they do that?
They don't do it in the patient room. We set up a room for them, and I'm going to have a sink and a bathroom. They can't do everything there, but they are, cleaning teeth, pulling teeth has lots to do with dentures and fitting teeth properly. So it's a lot of that kind of work. But at least for my population, it's been good, and they come about every other month is about the schedule is what I've seen.
So would you say that it is increasing dental services for your residents? Obviously, they have mobility issues or transportation. Like they couldn't.
Yeah, before this, they had zero unless we could get them to the dentist. But for the dependent bedbound patient and things like that, that was not possible. So for us, it's very good. But it's not perfect because you can't do everything in a mobile setting and things like that. So,
Interesting. Thanks.
Mhm.
Thanks for sharing, Representative Oliver.
Reimbursement for those patients in a skilled nursing facility, where does that come from?
we don't have to pay for it. They bill, I assume Medicare or Medicaid. I'm not sure. Yeah, or private pay patient. So, but I'm not quite sure.
Interesting. Thank you for that update.
Yeah, I'm not advocating, okay, let me preface this, but some states allow dental hygienists to work independently. This is not one of those states. There have been discussions about that and some fights. Would it help to have dental hygienists able to open a shop independently of a dentist for this issue of dental health hygiene? I'm not advocating, I'm asking the question.
I'll speak first. Let Dr. Studstill. This is what I advocate for. There's a new dental model that's called a community dental health coordinator, where a dental hygienist or a dental assistant in some cases, usually a dental hygienist, gets trained, and then with expanded functions allowed under the State Dental Practice Act, they're kind of a coordinator of care. And they can triage patients, and even with a teledentistry component, in some places in county health departments, they take on a very role, you know, and, you know, my opinion that various models and alternatives to dental access, you know, that nobody but the dentist can take these teeth out. And that's the ultimate greatest need. You know, having somebody that can help coordinate that care that a community dental health coordinator is trained to do, I see that as a good possibility down the road.
Can they also clean teeth?
Depends on the State Practice Act and their expanded functions, yes.
Here, can they?
No.
If they were able to, could that help the situation as far as improving people's health?
Possibly. Zach, you want to say anything?
Well, we've actually, the Alabama Dental Association has testified, that's not the right word. We just talked to the Board of Dental Examiners and talked to them about the Community Dental Health Coordinator model, and using that model as a demonstration, first of all, in public health settings, to see if a dental hygienist could see patients, triage those patients in a public health setting, send that by teledentistry to a dentist, let the dentist look at what's there, do a treatment plan. The dentist would do a treatment plan. Then the community dental health coordinator would set up appointments and dentists in those areas down there where he or she is operating, so the patient could get care, but she or he would have be diagnosed by a dentist. Now, we think that needs to be a demonstration process first before you move out into nursing homes and the school settings, to make sure that everything works right. If the board's looking at that, so it's not it's a dead issue, it's something they're looking at. So if that were to be a good project, something that works well for the patients and well for the dentist going to see them, then I think you could expand it potentially to someplace else where dental hygienists work out of those places, not under the direct supervision of a dentist. But I think we have to prove it first before we really get out and test and do more than just allow that as a testing.
Great. Thank you for that presentation. It was very, very informative. You were finished with your presentation? So Dr. Studstill, did you have other things that you wanted to add to
I do, Madam
presentation?
Chairman, thank you. I'd like to make a couple of suggestions for the task force to consider. The first, we have already in law, there's a rural dentist scholarship program, rural dental scholarship program. And that scholarship program, the way it would work, we would try to identify students in high school who have some interest in science, and then identify those students and develop a pipeline while they're in high school to go to colleges, mainly right now it's with the Community Health Sciences Department of the University of Alabama. They would go to the University of Alabama in the summer and have a several weeks type course while they're in high school. If they complete that in a successful way, then they could really be inside this program, which is a Rural Dental Scholars Program. Then when they graduate from high school and want to continue in the program, then they would enter the Community Health Services Department as a college student. If they complete that program successfully, they have a guaranteed slot to dental school. Now, what's the meaning of this? Really, what you have in the situation is you can identify young men and women in rural areas who really, at rural high schools, sometimes are not as good, sometimes as other high schools. Sometimes they're better. But one of the problems that one of the problems the School of Dentistry has is that admitting students who in college don't do quite as well as students who come from better educational backgrounds. This would be a way to really take students who in high school but are smart young men and women, put them into a program at a Community Health Science Department in Alabama, get them ready to go to dental school so they can maintain and take care of that, graduate in 4 years. This is a way for us to really get another way to get young men and women back into where they grew up and practiced dentistry. So it's already in the law, but I would suggest that potentially this task force look at the ways that might be funded in a way that with the School of Dentistry working with the Community Health Sciences Department at Alabama, that we might want to put some state money in this to seed that program to get it started. So that's my first suggestion, Madam Chairman.
Do you see me smiling over here? For the 10 or 12 years I've been in the legislature, I have preached and preached and preached that we need to take Alabama children from these rural areas, figure out a way to help them get what they need to become what they want to be so they will go home and take care of the population in their community that they've lived in all their lives. I'll tell you, I believe if you can get children to do that, that is the way that we keep people in rural Alabama, because they're engaged with the community, they're a part of the community, their families are there. And to me, it's such a more reasonable way to do this instead of trying to take somebody from somewhere else and just put them there. If you have a kid who wants to get trained and go back home, let's help them get there. And I thank you so much for saying that, because like I said, during the time I've been in the legislature, I have focused on things like that for a long time. And to have something like that in place, I will tell you, has my full support. And I guess I'd like to bring that up, for the task force as a whole to see how everybody else feels about it. But that has my full support, and I would definitely, ballpark, how much money do you think it would take to keep that program going or create it?
Well, at this point, Madam Chairman, it's going to be a guesstimate. Dr. Carla McKenzie, who's the admissions chair at the School of Dentistry and head of the community science, community science, I think, at the university, and Dean Teichman, have already been talking to the folks down at Alabama and Community Health Sciences. So they've had initial discussions. Nothing is formal at this point. So I asked Dr. McKenzie, I said, I might get asked this question, and so thankfully I asked, give me a ballpark figure that you could get this program off the ground and maybe run it for a year. And her ballpark figure, though don't hold us to this, but the ballpark figure is about $340,000.
I would say that's probably a deal. I mean, I was thinking it would be much more than that in my mind. And so, you know, when we take suggestions like this to the budget chairman and to the governor's office, everybody always asks the question, what's the ROI? What's the return on investment? If you're investing Alabama dollars, what's the return on investment for students and or for Alabama? And I think if you can, for $340,000, potentially take Alabama money, do something good for Alabama students and Alabama communities, and you can show a return of putting someone back in their community, offering a service, to me, that's one of the best ROIs we could ever present in a situation like that. Did you say is there already a pilot that has data with that, or this would be the pilot?
Actually, medicine has had a program for years.
John Wheat at Alabama, and lots of people, they've had that program for 25 years.
Yeah, I'm familiar with Rural Medical Scholars, but I was not familiar with Rural Dentist. So it's all that program that John Wheat created. I'm very familiar with that program.
Well, I think it'd be a comparison, Senator Weaver, as far as the ROI of the investment versus what has come out of that. I think it could be a side-by-side comparison. Dr. Studstill, don't let me steal that. That is Jeff. I think that is kind of what we're asking. Is be able to measure it, I think, not necessarily dollar for dollar or person for person, but it would give us an idea of what's happened in the past.
Right, and I think if you already have program numbers to support why something like that should continue, I'm very comfortable with the task force making that as one of the recommendations. If I hear a motion that anyone else feels that way.
I have a question. I think Laura Hall does too.
Okay.
I'd like to know what the return was on there are two of those programs, Rural Medical Scholars. 10 slots are reserved for a program at Tuscaloosa and 10 slots are reserved for a program in Huntsville that's tied to Auburn. I'd like to know what the return is before. I understand the state senator can do what she wants, but I'd like to see the return. And then would the requirement be that the student commit to work in Alabama after graduation for a certain period of time? I don't think that's a requirement in the medical school, but would it be in this program?
You know, that'd be a great addition, I think. That has not been part of the discussion so far, but that would absolutely be something I would support. If we're going to put our tax dollars in it, they ought to stay in Alabama, I think.
Yep, I agree with that.
And then also, how would this interact, if at all, with the AHEC program, their area health education centers? There are like 5 of them in the state, and they're based in UAB. Do they have any role, or?
That I'm not sure, Dave. I'm really not sure about that.
I think they could play a role, Dave. They already have funding requests. You know, I think that we don't. It's just like when we get together and we find these things out and having discussion is that we've got various people working in various lanes, and those lanes don't cross. And I think that's part of what we've been challenged to do as a committee is to find out what lanes or what barriers exist that will allow us all to get a greater yield for what we're all looking for. I mean, I'm not going to take up the time and pontificate on this, but I would tell you again, I've said this since the committee started, is that just like nurses in Alabama, rad techs in Alabama, everybody that we're looking from an allied health and support perspective, you know, we've got to get real about getting Alabama kids enrolled in Alabama programs in order to solve for our Alabama need. Because again, if we continue to take more in from out of state, I say it all the time, I got 200 clinical students rotating through my hospital this semester, all right? 35 to 40% of those that I engage are not from Alabama. They're going back to work in the state, in an adjoining state. We've got to get real about that, or otherwise we're not going to solve for this.
Thank you, sir. Representative Hall, I see your hand is up.
Thank you. Yes, I have a question pretty much has been raised in the statement earlier in terms of how do we coordinate efforts with organizations such as AHEC. And also, I would challenge us to also look at the education budget in terms of making sure that we um, make contact with these young people at much earlier age than high school as relates to the different careers and the possibilities and having that type of exposure. Thank you.
Thank you for your comments, Representative Hall, and I agree with you very much. Dave?
Madam Chair, would it be useful to have someone with AHEC to talk with the folk at the Tuscaloosa and Huntsville physician programs and with Dr. Stedsville Lockwood and maybe even explore EMTs? You know, getting high school kids interested in that and going to two-year school to get accredited.
And Mr. White, what I wanted to say, and I hate to interrupt, but we're doing that in Tallapoosa County with our school system right now, and we're actually requesting a teaching unit for that to start identifying kids 14 and 15 years old to work with them in an Explorer Scout program or a junior firefighter program and actually have an EMS teacher so that when they graduate from high school, they'll have EMS basic complete. And I was listening to these conversations. When you identify those kids at 14 and 15 years old, those are the ones that you want to live there. You want them to stay forever and ever and ever. And that might be a great age to start targeting for these kids you want a pipeline for all of these disciplines.
So having heard what you said loud and clear, maybe we should create maybe like a little subcommittee to discuss what you're talking about. Is there anyone that would be interested in serving on a subcommittee to discuss specifically the things that Dave was talking about related to how we all work together? Dr. Studstill?
No, I'd be interested in serving.
Would you be interested in,
I would be very interested.
in leading that subcommittee to pull that together for us?
I would be happy to do that if that's your pleasure.
Okay. Everybody in agreement with that? Okay.
And this would kind of explore, just basically getting into the schools, introducing the 14, 15, 16, these different areas of need, in Alabama, and then providing some type of maybe assistance or something like that to incentivize them to stay here, with stay in the state because they're from that town or city.
Right.
I'd be interested in
So,
assisting.
Dr. Studstill is interested. Chris Schmidt is interested. Kenneth, are you interested in being a part of it?
Yeah, I was just going to kind of add to the supporting part of this being the two-year college, being able to provide those young men and women a credential that when a life circumstance does happen at some point in time, I mean, this is a great program. It's going to have a good return on investment. But if a life circumstance happens and that young man or young woman can't complete, that they've got something that's in field though, such as a dental assistant or dental hygienist, something they can fall back on that can still put them to work in the field of dentistry. While it may not be dentist, it is something in that field that may be of interest to them. So yes, of course.
Okay, so let's, I'm going to make a motion that we will create a study group or a subcommittee with Dr. Studstill leading that and Kenneth and Chris both being on that as well. All in favor say aye. Any opposed? And if you guys have time just to pull some information and get it together for us, if you could bring us something to our next meeting, just to follow up on that, that would be fabulous. Is there anything specific that you had in your comments that is of interest to you, other than what you just said?
Well, I'm thinking it might make sense thank you for volunteering the subcommittee to talk with folk with AHEC and those two physician programs where they do get kids enroll and sometimes give them an extra year of college to qualify for med school. And to talk to them about, is this a model we want to follow? And then with dental and maybe incorporate EMT with the various folk that maybe, that would be a start, I would think, if that makes sense. And I'd be happy, I've got contacts with AHEC and with the physician programs, if that would be at all helpful.
Okay, so if y'all,
And I bet Ed Oliver has contacts with the EMT folks.
so as you get started, if you need any information, Dave's your guy, or if you have information that you need, call Caitlin and she can help coordinate between everybody to get you what you need. And if it gets to be a project that you need more assistance with, I know sometimes our friends in LSA have some information already related to state agencies and things that are operating at that level, correct? So a lot of times you guys are resources as far as specific information related to things that are currently in place here in the state. So Dr. Studstill, they're a good resource for you as well.
So I have a question. Just wanted to comment on the EMT. Is it because there's a shortage in that area? Or are we just looking at those two areas and not all areas that may encompass shortages in the workforce?
Absolutely.
Twofold. Rural areas, people move away anyway, so that's the catalyst for your shortage. EMS, paramedics, we have deserts right now where we don't have paramedics because you can go to nursing school in the same amount of time and make 5 times the money. Even though the skill sets are very similar, except one is emergency medicine and it's like ER technical type things versus a hospital setting. That is a problem that we're trying to address in my district right now by having the organizations that identify kids in high school that are interested in those disciplines. Typically, though, the money is what it comes down to. You just can't get people to stay interested in it. So we're looking at a stopgap right now for kids that want to bridge, so we have bridging programs in Alabama, that they might eventually bridge to nurse. We get a couple of years out of them as paramedics. Unfortunately, paramedic is a skill set that the more time you spend in the field, the bigger the learning curve, the more effective they are. So that's very difficult. So what we're doing to address that, though, is we're trying to get these kids interested, so that's what they want to do at 14 and 15 years old. I don't know why that would not work for any of the programs that we've talked about, is you get them started and you make them become part of their community.
And I agree with that because as a nurse myself, working with the EMT staff, when they come over for any rescues with us, I didn't know how underpaid they were, but I knew that there was a lapse there when it came down to pay. And they do a wonderful job, in the areas that they provide. So I'm not in disagreement with that. Just wanted to know where, we're going, because I know as a healthcare science teacher myself, doing the dentistry classes, training our students to be dental assistants right out of high school, and also working in, as CNAs in the nursing home. I think we need to focus and go back to that because there is an interest, but children, if they are not exposed to things, then they don't know about things. So on career days, we need to have that type of information presented to spark that interest in our students.
We're going one step further than that, and that is with, as part of scouting, is the Explorer program. And there are several in-school organizations, and we've gone so far now, we've got our school board trying to figure out how to add teaching units for these specific disciplines.
And on the EMT, it's definitely a shortage. We can't accept dialysis patients, for example, at some of our locations because there's no transportation to dialysis. So it's serious and severe. And my thought, I love the idea of getting more into the high schools and introducing these areas of shortage, educating them about, for sure, EMT, dentist, physician, definitely nurse, and career ladders and career progression. If you want to be a dentist, this is your progression. I like what Kenneth says. Some of the folks aren't going to be able to get all the way to be a dentist, but they can be an assistant or a hygienist. Same with the nurse. Some of our certified nurse assistants that we train through our own school, they won't get to registered nurse, but they might be able to get to med tech. Maybe a med tech could get to the LPN and the LPN to the RN. So just the, the concept of really getting in front of these high schools, the students here in Alabama, creating more Alabama kids, more Alabama students to get into the colleges, community colleges, and these different programs, because they're going to stay. We're recruiting all over the world right now, and we're hoping they're going to stay, but there's no guarantee. The percentage of the Alabama folks that we're sponsoring on scholarships, I feel good that they're going to stay, at least in the state. So, support the idea.
My final comment, I do like the idea about bridging, the bridge programs that we offer, for any, I think, entity, because it gives them that hopefulness that they can go from one area to another. So I really embrace that concept of, and I thank you for bringing that up.
And just one last comment on the EMS for just a second. I'm also a paramedic, so we were very gracious a few years ago. As a legislative body, you all may have even carried the piece that established the Volunteer Rescue Student Tuition Reimbursement Act, long word. It was for the Alabama Rescue Squads and the Alabama Volunteer Fire Departments to get trained EMTs in their area for a time commitment. At that initial rollout in, I believe, 18, it only covered EMT. We were able to successfully work with the legislators and get that expanded to where it now covers paramedic under that 3-year time commitment. But we've seen very low take of that program simply because it's rural. The same thing as what you're saying, sir, of your median average pay for an EMT in the state of Alabama is $23,000 to $28,000. And it's for 15 weeks worth of training, and it's not going to increase by very much more when they complete paramedic school. And so I think it probably ties a little bit back to their reimbursement structure, and if there's something there that we can do to really kind of get people moving through there. But as far as there are programs that are out there to be able to help with that and the reimbursed for that. But I think it's the time commitment of we're seeing graduates that come out, they don't want full-time employment. They want PRN or as needed because they want to test the waters first. And so it's hard to get them to commit to long-term. So I think as we establish programs, anything that has a time commitment to that time commitment may eventually at some point serve as a barrier to getting people to enroll in those type programs.
Thanks for your comments. Not to cut anybody off, but I understand our Zoom is about to cut off here in a few minutes again. And I want to give Dr. Studstill an opportunity to finish his comments.
Thank you so much. I appreciate that. And I do have a second suggestion for the task force to consider. I'd like the task force to consider recommending the 2023 legislative task force be set up to further study the reasons that Alabama is experiencing a shortage in the dental workforce and other healthcare professions, and recommend solutions that address the shortage and need for more healthcare workers.
Again, in my opinion, I think that is based on what we have seen here today. I think the numbers that Dr. Lockwood presented obviously show that we are about to have a cliff here. I know that we've had with nurses and some other occupations, but I think the one that we've seen here with the dentist certainly needs more study specific to dentistry, and I could support that. Do I hear a motion to support that creation of a dental specific task force next year? Motion by Ms. Benson, second by Mr. Schmidt. All in favor say aye.
Aye.
Any opposed?
Thank you.
So that will be one of our recommendations going forward. Any more comments, Dr. Lockwood or Dr. Studstill? Dentistry? Very, very informative presentation. Thank you very much for being here today. Appreciate you sharing your expertise with us. Our next meeting will be on November 17th at 10 a.m., hopefully in this room. And we will send information out about that meeting beforehand. I know, how much time do we have on our Zoom?
4 minutes.
4 minutes, okay. For the sake of time, any comments in 4 minutes? Mr. White.
Yeah, question, would it be useful to explore the legality or making it legal, or maybe it's already legal, for a county or a city to offer a financial inducement to a dentist to come to his or to their town? Physician heal thyself. If there's a problem in an area, maybe you'll say, all right, knock yourself out. Offer them office space or offer them, a certain amount of money.
Are we already doing that? I mean, it's like incentives that is it?
Well, is it possible now for a city or a town, a city or a county to say, hey, we don't have a dentist, we need one. Let's offer this building rent free, and maybe 50,000 a year for its expenses, and let them recruit.
That's already happening in some places where they're
It's legal.
So maybe a local solution is best. Kind of like hospitals training or paying for scholarships for LPNs to come and work for them.
Yeah. We're gonna cut off in a minute. It's legal to do, but again, there's got to be some.
No, I'm not saying employed by the city. I'm just saying the city offers an incentive for the people to come.
Yeah.
Once again, it's legal to do, but you got to make sure that it meets all the regulatory requirements from a fair market value perspective, et cetera, especially if they participate in Medicare and Medicaid reimbursement. So again, that again is another barrier to much of what we're talking about today is regulatory compliance as well as cost of care, all the things we have before us as providers of healthcare.
Any more comments from the group? Hearing none, we are adjourned. Thanks everyone on Zoom for attending, and we will see everyone on November 17th.